Morning, guys. This is Dr. Tancini at Ground Overhead Physical Therapy, and it's about 36 minutes after the time that I intended to start this morning. I apologize for that. I promised you guys I'd have it out at 8 a.m. every morning, and a little bit late. Was having a little bit of technical difficulties this morning, and got them all worked out, and we are ready to go. So apologize for that. But that's all good, right? Because things like that happen. And we adapt, we overcome, and we keep moving forward. So, guys, it's Monday morning. It's absolutely beautiful outside. I'm not sure if you guys can hear, but all the birds singing. It's clear skies. It's man, the temperature is awesome. It's going to be an awesome day. Mondays aren't something to be dreaded upon, right? Mondays are the day which we get to get back to most of us starting to or continuing to do our life's work. Um and be able to go in, start your week off right, start the day great, and be enthusiastic about the Monday because it's what you want to do. It's what you love to do. And if you're sitting at home right now and you're like, man, I used to really enjoy Mondays until I stopped work, and now I'm just sitting at the house, and uh, I used to like it, but things are different now because of the COVID-19 and I'm quarantined and I can't do this and I can't do that. Well, guys, it's okay, right? So it's okay. Like, circumstances change over time, and ultimately, it isn't about the circumstances, how you adapt and overcome that circumstance. Because what you do is, should be formulated, right? Regardless of the circumstance. Like you've got a choice to make today great, and you've got a choice to make this week great. You've got a choice to make every interaction you have with the person you're talking with, whether that's over Skype or Zoom, on phone. Maybe it's with your husband or wife inside the house, or maybe it's with your kids, maybe it's with your dog. Right? It's like you've got an opportunity to act in the way which is of your best self. So treating people with a respect, treating every task like it's the only task on your mind, and it is the thing you want to absolutely be great at, regardless if it truly is. But if it's in your nature to want to do the best in everything you do, well, guys, go into every opportunity and every interaction you have in order to essentially live out that definition for yourself and being the best that you can be, regardless of the external situations. Okay, so now, it's important to know that, right? Like, confidence isn't about your circumstance. Okay, confidence is about your inner belief that you're able to get stuff done regardless of the circumstances that are dealt to you. Okay. So, guys, confidence is the ability or the mindset that you can overcome whatever obstacles in your way. It has nothing to do with the circumstance. It has everything to do with your inner belief that, yes, I may not, I may not know what to do in the whole COVID-19 pandemic because I've never been in a pandemic before. But I understand that I've got the ability and I'm fully capable of overcoming the situation, making it the best that I possibly can, and absolutely crushing the day and getting through this way better than I was when I started. And every one of you guys has that ability. Is have the confidence that you're gonna be better for whatever's thrown at you, and you're gonna be able to have uh, the know-how, and you're going to be able to figure out how to overcome the situation you're in, to make it the best ever, or the best that it can possibly be. Now, is it going to be easy? No, it isn't going to be easy, but it doesn't matter. You can still figure it out. Have that belief that you're going to figure out your situation, and you're going to make today and this whole situation the best you possibly can. Okay, guys. So, if you don't know me, my name's Dr. Michael Tancini. I am the owner and physical therapist at Grounded Overhead PT. And ultimately, I work with athletes. Remember, if you have a body, you're an athlete. And if you want to be, and if you want to move in your life and you want to lift weights, you want to go outside and run, you want to pick up your grandchild, you're an athlete. Like your body's meant to move, your body's meant to perform on a daily basis. Okay. And do whatever is asked of it to do. And it's fully capable of doing that. So I work with athletes. Um, I help people get back to doing the things that they want to do fast, as fast as possible. Um, I help them stay moving while they work through their problem. Um, and I help them permanently fix the problem so they don't have to waste their time on any other quick fixes or any of the gimmicky stuff you see out on the internet or may have tried. Guys, I help the people that I work with get results fast, get results permanently, so you can live your life the way that you want to live it. Oh, ultimately, that's what I do at Grounded Overhead PT. And one of the ways we do that is one with mindset, right? So much like we're doing this morning, and also getting people opened up and more mobile. Okay. So we get their minds right. We get them stronger. We get them more mobile. We help people get more control. We build the of resilience of the body, helping build a robustness through that body so that you can take on any task that's going to come your way. Uh, so this morning, okay, let's dive into our mobility. Okay, so we're gonna get the chest opened up. I'm gonna use some different stuff here that you probably don't have at home. That's okay. The first thing I need you to get is just like a bag, right? So like something with a little bit of weight in it. It doesn't have to be too heavy, but just get a little bit of weight. Uh, the next thing is, so this can be a bag, a sack of potatoes. It can be a milk jug. It can be, a heavy water bottle. Um, it can be a loaded laundry basket. It can be a loaded backpack. The loaded backpack would probably be the best thing. Um, so go ahead and grab that now. Um, Next is, you need something with a little bit of weight in it that you can hold in a single hand. This is going to be like your books. So maybe if you have a few heavy books, maybe if you've got a few heavy soup cans or maybe heavy jars, they'll be excellent for this. And lastly, something where you can just reach back and grab, like a table or a countertop or a back of the chair or a back of a couch. Okay. So first thing we are going to do, all right, is I want you to grab that heavy bag. I've got a barbell here. This is a 20-pound barbell. It doesn't have to be 20-pound, guys. We're looking something between, as long as it's 5 or 10 pounds, you'll be good with. Okay. You're gonna lay with your head at the tail end or at the foot of your bed or the side of your bed. Okay. We need something to where we can drop the arms down overhead. Okay. So you're gonna lay, bend your feet. Okay. So I'm actually going to slide forward. Okay. And just bring my feet up. You can put your feet down on the bed though. we're going to grab the object, okay? And we're going to lower it down overhead. Just get a nice stretch. So you're going to feel this through the lats. Should feel pretty good, especially if you get a bunch of pull-ups this weekend. And we're going to work through 15 a here. It's breathing for about a 2 count at the bottom. Guys, if you caught my run clinic this past weekend, thank you so much for tuning in. I'm going to be sending out all the recap of the run clinic here in a little while. I'm going to send you guys all the videos of the run drills, all that awesome stuff. So if you came to the clinic, check your email here in a few hours and the show will be there. If you didn't come to the run clinic, you missed it and you want to tune in and see it, I'm going to upload it at the end of the week or at the start of next week for anyone who wasn't in it. Okay. If in case you want to watch it afterwards, I'll post this up on my Facebook page. It'll be on my YouTube channel so that everyone can tune in and see it. In about 2 weeks, okay, I'm planning not this weekend since it's Easter weekend, but the Saturday after Easter. I am going to do another clinic. Okay, it is going to be a shoulder mobility, and particularly to help people through shoulder and shoulder pain, neck pain. So looking at pain around the front shoulder, we're looking at anywhere around that shoulder. Fixing that pain is what the clinic is going to be targeted at. Okay, so hopefully you guys can tune in to learn how to not only fix your shoulder pain, but completely eliminate any pain you have and set yourself up so you don't have to deal with shoulder pain in the future. So I'm going to be putting out the info on that here soon. So make sure you stay tuned for that. And so I'm not sure how many this is because I was talking and I lost count. But let's do 3 more. There we go, guys. That is number 1. Okay. Hopefully that felt good. I'll give everyone a second to just drop the bag and get ready for the next one. Guys, with the COVID-19, I am still seeing people in the clinic. I'm seeing a lot of people still regular hours in the clinic, taking every precaution to keep everybody safe. But I also have a lot of people who I'm doing telehealth with. And essentially, I do assessments and video sessions, and I teach you how to fix yourself through video. It's very, very effective. I've been doing it now for the last 3 years. It's just been something that has increased in volume as of lately, and people are loving the sessions. And they're getting a lot out of them without leaving the comfort of their home. So if you're watching this right now and you're like, hey, like, I need help, but I don't want to go out of the house because I don't want to get the virus, the telehealth and video sessions are an excellent option for you. Essentially, dive into exactly what's going on through video assessment. And then I'm able to dissect it, get a pretty clear picture of what's going on, and walk you through how to fix it at home, so that you can make the use of your time, and ultimately get you feeling better and get back to invest. Uh, so, guys, I'm going to offer anyone watching this today a 50% off of any telehealth visit. Okay. For the next 2 weeks. All right. So any telehealth visit for the next 2 weeks, actually, let's make it through the end of April. Okay. So any telehealth visit through the end of April, 50% off. Okay. And this is any kind of telehealth, virtual assessment, or or running analysis. Okay. So running analysis I can do to fix your problem when you run, and fix any pain associated with running through a run analysis through video and coaching on the back end to help coach you into running better so you don't have these problems. So 50% off, guys. You've been dealing with pain for weeks, days, months, years. Then, it's time to get it fixed. It's time to turn to a solution that isn't gimmicky. It's time to really address the root cause of your problem so that you don't have to deal with this problem after the COVID-19 is out of here. You can get back to living your life to the fullest and absolutely loving life, because life is way more fun to live when you are feeling great. So next, okay, I'm going to do both arms at the same time. You guys are going to do one arm at a time, unless you have a way to do both arms at the same time. So you're going to come here. I've got plates. You're going to hold a book. Okay. You're going to lay down on the side of the couch or side of the bed somewhere. It's where you can drop the arm down just like this. Okay. Now you're going to put your feet up on the bed or the couch, bed just like this, but I'm gonna have them up since my bench isn't that big. And we're gonna bring the arms out and we're gonna do a snowy. All right, so keeping the hands nice and low to the ground. And we're gonna work through. All right, do 10 to 15 of these. Nice and slow, trying to really work those thin limits. This one feels so good, guys. As you'll probably feel now. All right, guys, if you did one arm, go ahead and swap around and do the other side now. I'm going to give you guys about a minute. Um, the first two we're doing today, guys, they're actually all three of these. We're going to do our excellent to include in your daily mobility, or maybe 2 to 3 times a week. Everything I show you guys is very tactical. It is very action oriented things which you can do on a regular basis. I'm not just throwing a bunch of fluff at you guys. Like these two, I literally do almost every day. I do at least 5 days a week. And it works wonders with helping not only prep yourself for any kind of pressing or snatching or cleaning, or pull-ups or toe to bar, anything up overhead. But it goes a really long way with unwinding some of the tight tissues that you might have from working on the laptop all day, being on the phone, working on the computer, all those things that make you super tight. Okay. So excellent ones to get. And so who did the uh CrossFit charity workout? All right. If you're signed up for that, awesome. It's great to be a part of the community right now. You don't have to give money. Okay. There's a lot of gyms out there and your gym personally probably needs your help. So a small donation would be awesome. Just to show them that you care about them, you want to help them get through this time. They've got to have the doors closed. So it's an excellent way. If you're not signed up and you're a member of your gym or a friends of a gym owner, go ahead and put their gym in there because all the proceeds go to helping that gym. If you don't want to give anything or you don't have the money to give, then that's okay. Then sign up, show your support, participate, okay, and maybe try and get somebody else who uh, maybe isn't as active as they need to be. Maybe get them to sign up too, okay, because they're all things that you can do at home. The skill level needed is pretty low. Um, and like the week one, as you might know, had dumbbell snatches at it. Like you can in the workout description, you can snatch a milk jug, you can snatch uh, a soup can, you can snatch a backpack, you can snatch a pillow, right? So like it doesn't matter what you have, you can make it work. This isn't the open, like you don't need a judge, it's all just be honest with your scores, put yourself on there and just be a part of a community, show your support and try and gather and rally others in this time of need. So next, guys, you are going to take your hands. You're going to grab onto the countertop or the back of a chair, and try to keep the shoulders back, and you're going to sink down. And you're going to feel a nice stretch through the front of the arm. Now, you're probably having to go palms down to grab onto the edge of the countertop. So let's come here. Feel the stretch, hold it for a few seconds, then back up. Let's come down. And we're going to do 15 here. Guys, try and keep that chest nice and tall and the shoulders back. All right, guys. There we go. 3 mobilizations for the day. Okay. 3 easy ones to get your day started great. Get out there feeling awesome. Remember, guys, many of you guys have been battling pain for a long time. Um, and you know, it's stops you from being able to work out the way you want to, maybe play with your kids the way you want to, maybe it stops you from doing the work around the house or the yard like you want to. Maybe you constantly need to scale and modify at the gym because you're afraid that you're going to blow up your back or completely wreck your shoulder. Um, and you're just scared of doing certain movements. Maybe you're scared of picking up your son. Maybe you're scared of picking up uh, the laundry basket, or bending over because you just think the back's going to blow up. Well, guys, you don't have to live in that fear. You don't have to live in pain. Um, you don't have to live in those weeks and months and years in the future, dealing with the problem that you're having. You can fix it permanently. You guys, I can help you do that. So once again, yeah, give me a call, send a message. Give me a call at 919-960-1351. Send a message through Facebook or email. Guys, I'll be happy to help. I'm happy to, I'd love to talk with you about your individual situation, things that you can get on the road to fixing it permanently so you never have to deal with it again and enjoying life and living life to the fullest. So guys, virtual assessments and video assessments are, an excellent option for you right now. 50% off of that video assessment and coaching through how to fix yourself. Guys, send a message over. You've got until the end of April. I am staying busy. So the spots are pretty limited. So reach out now, get on the schedule, and let's get you back to feeling awesome. So guys, thank you so much. This is Dr. Tancini here at Grand Over at PT, coming at you from my home office, aka my home gym, where some snatches are about to go down here. And if you made some snatches, some back squats, should be a good morning. So guys, thank you so much. Enjoy the day. You can hear the birds. It's beautiful. Get outside. Go for a walk. And life's awesome. Life's a gift. Go out there and live it the best you can. Take advantage of every day and every opportunity you have to be your best self. Screw the circumstances and make today your best, regardless of what you have going on. So, guys, if you need an accountability partner, I want to know about your workouts. Send me a direct message, and I want to know about your workouts. You might think, oh no, she doesn't care. I'm not going to waste his time. No, if you need someone to keep you accountable, guys, send a message and I will keep you accountable. To make sure that you get through this time the best you absolutely can. So guys, thanks. I'll see you tomorrow. I will be coming at you live tomorrow morning as well at 8 a.m. I promise I won't be late this time. Hopefully we don't have any technical difficulties, but I'm going to make sure we don't. So guys, have a great day. And thanks for tuning in.